Dear students, today we will discuss rheumatology disorders, and mostly we will focus on discussing syndromes in rheumatology, arthritis and arthrosis syndromes. There are many diseases which can result in damaging of joints, and on the first place, of course, this is inflammatory diseases. Inflammatory diseases of joints can be caused by all 5 classes of known pathogens like bacteria, viruses, fungi, protozoas, wounds. And on the second place is degenerated dystrophic lesions, for example, which includes osteoarthropathies or deforming osteoarthritis. And next is metabolic joint damages during the gout or pseudo-gout. The fourth place is there are secondary arthropathies which can develop during disorders, different kinds of disorders, from blood diseases can result in damaging of joints, oncological diseases, endocrine pathologies, or sometimes even skin diseases, connective tissue disorders, disorders of liver, liberation diseases, and etc. And also, of course, traumatic and post-traumatic damaging, traumatic arthritis, and combined form of joint diseases. Before starting discussing arthritis and arthrosis syndrome, I'd like to give you common information about how inquire the patient, how take history of patient, also how palpate and observe the patient with joint disorders. During taking history of patient, you should collect the complaints of patient, and the pain is the most common complaint of patient with joint disorders. Pain may occur in the joint, may be spine pain, may muscle, ligaments pain, or tendons. It's necessary to clarify the location, rhythm of pain, intensity, radiation, factors that cause and reinforce of weaken them, the connection with movement. On the second place is, of course, morning stiffness symptom. Morning stiffness, it's important to find out duration of morning stiffness. For example, in arthritis, maybe more than 1 hour, and duration of morning stiffness in osteoarthritis, for example, maybe less than 30 minutes. Then also you should ask about difficulty of movement in the joints and which kind of joints involves, and maybe sometimes present there crunch symptom in the joint, and also patient can give you complaints as swelling of the joints and redness of skin above them. General manifestations also takes place if our joint damaging connected with connective tissue disorders, or sometimes with metabolic disorders. General manifestation includes malaise, weakness, fever intolerance to sunlight, changes of skin or mucous membranes, rashes, sores, discoloration of skin of the fingers, or sometimes may occur the pain and burning during urination, or sometimes the feeling of sand in the eyes. This is all symptoms mostly occur in connective tissue disorders. Also, on those kind of disorders can damage the joints. During asking, inquiring about pain, pay attention about the intensity of pain. And for example, sometimes pain will be mild, sometimes moderate, even till very severe pain. And this is pain scale from 0 to 10 score. There are maybe damaging many symptoms, many joints, and depending on which kind of joint damage, you can suspect the diagnosis. For example, in gout, mostly gout can cause damaging of weak joints. For example, rheumatoid arthritis can damage the symmetrical small joints. For example, in osteoarthritis, may damage the overloaded joints like hip joint or like knee joint. During taking history, anamnesis of patient, pay attention that sex and age is very important. For example, in systemic lupus erythematosus and rheumatoid arthritis more often occur in women as a whole other autoimmune disorders. Reactive arthritis, gout, and spondylitis more common in young people. Osteoarthrosis and osteoarthritis is more common in elderly patients. Family history is also very important because there are many hereditary predisposing factors in spondyloarthritis and rheumatoid arthritis, even in gout. When you are taking history about infection and epidemiological history, pay attention about the presence of transfer-specific infection diseases like gonorrhea, brucellosis, tuberculosis, presence of chronic disorders like tonsillitis, colitis, urethritis, and also connection with acute infections of the upper respiratory tract. For example, acute rheumatic fever may develop after acute tonsillitis. Often reactive arthritis develop after intestine disorders or urogenital infections. And also pay attention about induced factors or trigger events like inquiries, injuries. Some disorders can start after inducing injury or hypothermia or after taking some medications or after previous illnesses or after alcohol abuse or taking heavy meat. Sometimes prolonged diuretics using also can induce the attack, for example, of gout. During examination of joints, you should examine the joints at rest. Also, we use examination of joints during movement, and it's very important palpation of joints should provide with movement in joint. And how you interpret of changes during examination. First is local signs of inflammation and damages. As joint shape, you should assess joint shape changes, swelling and increasing joint in size. You should be able to detect deformities. Any deformations indicates a long chronic processes of inflammatory or degenerative nature. Also, you should be able find out redness and increased temperature of the skin over the joints. And also you should palpate and assess that is there any pains during palpation and joint dysfunction. There are many deformities of knee, and during observation you can find out these deformities. For example, first type of deformities belongs to the osteoarthritis, and second type is mostly belongs to and typical for inflammatory processes like arthritis. For example, when your patient has hypermobility, it will be third picture, and etc. During joint palpation, you should be able to determine the temperature of skin over the affected joint. It's very, very important because joint may damage by degenerative process or may damage by inflammatory process. If present inflammatory process, of course, the temperature over the skin, over the joint will be high. Soreness in joint and periarticular tissues, localization of points, the presence of rheumatic or rheumatoid nodules, gouty, tophus, fibrosis, bursitis, and etc. Also, you should palpate the joint swelling and what is associated with. Swelling can be caused by exudation into the joint cavity, thickening of the synovial membrane, extra-articular soft tissue inflammation. During palpation, also you should find out presence of sounds like crunch, gout, or crepitus. To determine the crunch, you need to cover the affected joint with the palm of your hand and use your other hand to make movement on this joint. Crunch can be heard even from a distance. The most often causes of crunch are partial and complete destruction of articular cartilage. For the diagnosis, for example, of rheumatoid arthritis, a lateral compression test of small joints of the hands, for example, proximal interphalangeal or metacarpophalangeal, feet and wrist is used. When these joints are affected, patients respond to a slight lateral compression and handshake. Notably, each joint uses its own palpation techniques. Also, to determine any kinds of deformities, you can use measuring methods by using a centimeter tape, a limb length in order to determine shortening or lengthening of the limbs, and the circumference of the joints with a centimeter tape in order to determine the increase in volume of the joints and the degree of muscular development. And during investigation and examination of joints, you can use volumeter to measure the degree of joint mobility. To diagnose hypermobility symptom, we can use Bate's modification, Bate's score, and there are different kinds of movement, and total score, this is 9, and person who has more than 5 score, he has predisposed to hypermobility, and 8 to 9 score, this is exactly hypermobility symptom. And let's start our discussing about the today's symptoms. First is arthritis symptom and arthrosis symptom. What is arthritis? Arthritis is an inflammatory condition affecting joint, and arthrosis is degenerative, non-inflammatory condition where the cartilage of the joints are affected by wear and tear. Let's start discussing from osteoarthritis. This is most common joint disorders. And very closely connected with age and characterized by degeneration of articular cartilage. Structural changes in underlying bone are secondary. Osteoarthritis, arthritis or osteoarthrosis, this is similar for detection of degenerative damage of joints is chronic joint disorders in which there is progressive softening and disintegration of articular cartilage accompanied by new groove of cartilage and bone at the joint's margins like osteophytes and capsular fibrosis. Osteoarthritis, they have many risk factors. So the first place, of course, is age and gender, most common for women, genetic predisposition, traumas, obesity, and quadriceps muscle weakness, and sometimes it may be heavy physical activity. Here is many risk factors, mainly joint damaging by degenerative process may be primary and secondary. The secondary may occur after traumas, or for example, after genetic hypermobility. Primary mostly caused by primary risk factors. This is of course age. The older, the more common. Professional overloading, also predisposed risk factor. Gender. This is a woman, and also hereditary predisposition, overweight or obesity, and maybe combined pathologies like metabolic disorders, and also professional sport, and also professional sport often accompanied by traumas. Prevalence of osteoarthritis increase. The more age, the more prevalence of osteoarthritis. You see, up to 20 years old, we have osteoarthritis occur in less than 1% of population, and after 50 years old, it's about 1/3 of population suffered from osteoarthritis and arthrosis syndrome. In age of more than 60, about 90% can suffer from arthrosis. And here are groups of joints which mostly involved in osteoarthritis or arthrosis syndrome. This is mostly all overload joints involved in osteoarthritis. And here is a distribution of among the male and female, which kind of joint mostly involved in according to sex of our patient. And morphology of you see here is normal morphology, here is morphology in osteoarthritis or arthrosis syndrome. We determine the enlargement, proliferation, and disorganization of chondrocytes and superficial part of articular cartilage, and increasing water content of matrix and decreasing proteoglycans. Normal you also see normal cartilage and damaged cartilage in arthrosis. And also it will be detectable here fibrillation of the articular cartilage, and also severe osteoarthritis with exposing and articular surface exposing subchondral bones and subchondral cyst formation you see, residual articular cartilage. And also malformated subchondral cyst, the fracture gaps allow synovial fluid to be forced into the subchondral region to form fibrous walled cyst. Pathogenesis of osteoarthritis. Many risk factors like obesity, anabolic abnormalities, or microfractures and bone remodeling, loss of joint stability, any traumas can cause abnormal stresses. And also age, genetic predispositions, immune system activity, inflammation can cause also both these factors combined and cause compromised cartilage, and as a result we have cartilage breakdown. And cartilage breakdown can develop due to imbalance between the synthesis and degradation of cartilage matrix. Synthesis factors is anti-inflammatory cytokines, growth factor, collagen synthesis, proteoglycan synthesis, and degradation factors are all degradation factors which we already put. And there are 4 stages of 4 grades of damaging, for example, of knee and knee joint. And first grade is softening, and next grade is fibrillation, next grade, third grade is partial thickening, and also full thickening, and we have losing of cartilage membrane. And pain is a main symptom of osteoarthritis, and clinically pain in the affected joint, and pain is determined by bone damage, maybe pain occur due to osteophytes formation, microinfarction, increased pressure in the subchondral bone and the medullary canal. and maybe pain because of joint inflammation, because of inflammation of joint of the synovial membrane and extension of joint capsule. Maybe pain acute because of involving periarticular tissues like ligament damaging, muscle spasm, and bursitis, or sometimes maybe psychoemotional or other factors. Pain usually in arthrosis has a mechanical character, that is, it intensified with physical activity and weakened at rest. Sometimes pain varies depending on temperature, humidity, and atmospheric pressure, which affects the pressure in the joint cavity. And also because you should know, because arthrosis is non-inflammatory disorders and swelling not character for arthrosis. If your patient has arthrosis and you are detecting swelling of joints, is sign of secondary synovitis. Also, you can detect the crepitus or crunching or crackling or cracking and the joints during movement, limiting mobility in the joints or blocking with the articular mouse. What is articular mouse? Mouse is a fragment of articular cartilage that lies really in the joint cavity. An increase in the size of joints often occur due to proliferative changes like osteophytes, but may also be consequences of edema of the peripheral tissues. And especially characteristic is the formation of nodules in the distal and proximal interphalangeal joints. If formated the nodules in the distal interphalangeal joints, it called as Heberden nodules, in proximal as Bouchard nodules. Most common joints involve knee and hip, and you see here Heberden nodes and in distal Heberden nodes and Bouchard nodes. And here also Heberden and Bouchard nodes. Morning stiffness, character for arthrosis, less than 30 minutes. Restriction of active and passive movements in affected joints, and also atrophy of the surrounding muscle. Also, arthrosis process can involve not only joints, also can involve the spine. And here you see osteoarthritic spine. Osteophyte impede the spinal foramina nerve root compression, and which result in radicular pain, muscle spasm, muscle neurological defects. And here also we see Heberden nodes and Bouchard nodes. And here is observed the deformities of knee joint. How we diagnose? Laboratory studies, there are no pathognomonic signs for osteoarthritis. However, lab studies should be carried out for the purpose of differential diagnosis. Radiographic changes in osteoarthritis by X-ray, you could find the joint space narrowing, subchondral sclerosis, subchondral cyst, and osteophytes. Here you see on this picture, of course, here a woman which suffered from overweight and obesity, and overweight, obesity, and her sex also predisposing factors to arthrosis formation. And on X-ray you see narrowing of joint space, subchondral sclerosis, and also formation you see osteophytes. Here's also osteophytes, and also you see a very narrow joint space, narrowing of joint space, osteophytes, subchondral sclerosis, a typical picture, X-ray picture of arthrosis. The same pictures here, osteophytes, subchondral sclerosis. Also you see osteophytes, subchondral sclerosis, and narrowing of joint space. Also, arthrosonography is very important method to detection the any kinds of osteophytes. Here as you will see subchondral sclerosis, also to detection of synovial fluid, the amount of synovial fluid, also maybe some cyst formation in ultrasonography. And very important methods, MRI and CT scan, they can detect not only thick tissues like bones and cartilage, and also can give us information about the muscles, about the ligamentous. Here is also arthroscopy is a direct visual examination of the cavity of the knee joints, allows you to establish inflammatory, traumatic or degenerative lesions of the meniscus, ligamentous apparatus, cartilage, synovial membrane, and arthroscopy is a gold standard for assessing cartilage at the early stage of diagnosis, as well as dynamic against the background of treatment. Here is ultrasonography. It's very important. Arthroscopy, very important method. And also sometimes we use the detected biomarkers currently being investigated for evaluation of osteoarthritis. There are several kinds of biomarkers. For example, biomarkers related to collagen metabolism, biomarkers related to aggrecan metabolism, and related to other non-collagenous proteins, and biomarkers related to other processes. Of course, these biomarkers will check on the high-tailored clinics which is investigating the osteoarthritis. Okay, and let's discuss about the arthritis. Arthritis, this is infective disorders and of course among the cause on the first place belongs to the infections of joint inflammation, which caused by bacteria, and can have non-specific etiology like rheumatoid arthritis, reactive arthritis, and specific etiology like tuberculosis, syphilis, syphilitic, gonorrhea, brucellosis, and etc. Also may caused by virus, and also may caused by candidas. Arthritis may cause by metabolic disorders like gout, pseudo-gout, or sometimes may caused by connective tissue disorders like systemic lupus erythematosus, like rheumatoid arthritis, like scleroderma, like dermatomyositis, and also may develop after traumas and which can occur which can cause post-traumatic arthritis. Rheumatoid arthritis is most common disorders, more character disorders for arthritis syndrome, and let's discuss rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disorder that may affect many tissues and organs, but mainly attacks the joint, producing an inflammatory synovitis. Rheumatoid arthritis is autoimmune disorders, and pathophysiology of rheumatoid arthritis, of course, this belongs to the detection of autoimmune response. In pathophysiology, in developing process, first we have a reaction of antigen with the antigen presenting cells, and then antigen presenting cells presentate antigen to T cells, and we have here a T and B cell proliferation, angiogenesis in synovial lining, which cause the neutrophil accumulation in synovial fluid, cause the synovitis, and early pannus formation. What is pannus? Pannus is granulative, aggressive tissue that spreads from the synovial membrane and invades the joint. Here you see very aggressive tissue. This aggressive tissue name is pannus. Pannus can cover the joints and can cause degradation of joint tissues. Also cause subchondral bone erosion and chondrocyte proliferation, laxity of ligaments, and result in joint instability, contractures, and decrease the RHEUM and systemic complications. And typical for rheumatoid arthritis is a symmetrical lesion of the second to fourth metacarpopharyngeal proximal, interphalangeal joints of the hands and wrist joints, as well as second to fifth metatarsophalangeal joints of the feet. And symptoms, most common symptoms of rheumatoid arthritis, this is often swelling of joints, affected, their joints are swollen, red, tender, and tender when squeezed. And of course, swelling occur due to synovitis. And rheumatoid arthritis, you see here, disturbance of rheumatoid arthritis. Here is a synovial fluid involvement and thickening of synovial membrane and degrading of cartilage. And also prolonged time can result in the deformities of rheumatoid arthritis, and sometimes may occur different kind of deformities, like for example swan neck deformity, or the deformity arises from hyperextension of the proximal interphalangeal joints, while the distal interphalangeal joints is flexed. For example, mallet finger, like button ear deformities, like swan neck deformities. All these deformities character for rheumatoid arthritis. Mallet finger, button ear deformities, and swan neck deformities. Mallet finger is a simple flexion deformity of the distal interphalangeal joints, preventing extension. And sometimes you could find out severe hyperextension of the interphalangeal joint of the thumb. And also maybe there are other symptoms like fatigue, this is general symptom, and joint pain. We already said that joint pain includes the small joints, joint tenderness, swelling, redness, and warmth. Because of inflammatory reaction, we have whole 5 features of inflammation. And joint stiffness, duration of joint stiffness more than 1 hour, loss of joint range of motion, many joints affected. This is polyarthritis, very rare monoarthritis, and also it will be seen deformities, and both sides of the body affected, this symmetrical character. And here is stages of rheumatoid arthritis: early stage, intermediate stage, and late stage. And these stages of rheumatoid arthritis, of course, depends on duration and also depends on activity. Sometimes from early stage till this late stage, maybe these deformities occurring takes, for example, 10 to 15 years. Sometimes, for example, in my clinic, I saw when this kind of deformities develop even during 3 years because of high activity, high active process. Here is also like deformities, swan neck deformities, and deformities of the knee joint. Sometimes you can find out during observation rheumatoid nodules, because rheumatoid nodules, rheumatoid arthritis, this is autoimmune disorders, and this is autoimmune disorders can also involve to pathological process, process skin, and also subcutaneous tissue with formation of rheumatoid nodules. Here also bursitis of the left ulnar joint with multiple rheumatoid nodules. This kind of rheumatoid nodules can appear during exacerbation of disease, and after remission maybe disappear. And here is also this early stage and this late stage of rheumatoid arthritis, which can result in very worse deformities like this picture. Sometimes arthritis, rheumatoid arthritis can accompanied by other connective tissue disorders like systemic scleroderma or like systemic lupus erythematosus. How we diagnose? Of course, on the first place is X-ray. You provide the X-ray of hands and feet, generally performed in people with rheumatoid arthritis, or you could use other methods like MRI methods or ultrasound. And here is Steinbrook X-ray stages of rheumatoid arthritis, and what you see in rheumatoid arthritis on X-ray. On first stage is you could find out only periarticular osteoporosis. You see periarticular osteoporosis. On the second stage, you could see narrowing of the joint space and appearance of small patterns and cyst formation, erosions and cyst formation. On the third stage, presence of multiple erosions and subluxation of the joints. And the fourth stage, formation of ankylosis. You see there is no joint and only formed one structure, and this is one structure which can not move. This ankylosis formed. Here also any deformities, different kinds of deformities, and also narrowing of joint space, and also you see bone erosions, and also subluxation and luxation, subluxation of joints. During lab test, you could find rheumatoid factor, a specific antibody in the blood. Negative rheumatoid factor does not rule out rheumatoid arthritis. The arthritis is then called seronegative, most common during the first year of illness, and converting to the seropositive status over time. If you couldn't find rheumatoid factor, of course you should be able to investigate patient to the anti-circulinate protein antibodies. Like rheumatoid factor, this is testing is only positive in a proportion of all rheumatoid arthritis cases. Unlike rheumatoid factor, this test is rarely found in positive of rheumatoid arthritis is not present, giving its specificity is about 95%. Other blood tests give you increasing ESR and rate at which red blood cells precipitate in 1 hour period, and C-reactive protein which found in the blood in response to inflammation. Full blood count gives information about all blood cells, and sometimes you can check the kidney function to differentiate from other kind of disorders, or to detect the involving to autoimmune process kidney and liver enzymes. Sometimes arthritis is not only rheumatoid arthritis. Sometimes arthritis may be due to metabolic disorders like gout and gout. These disorders which accompanied by hyperuricemia, and uric acid has an end product of purine degradation in human. Hyperuricemia is a serum urate concentration, is excess of urate solubility more than 6.8 mg per deciliter. Can results from overproduction and or underfixation of uric acid is a common serum abnormality, but does not result in gout without crystal deposition. Gout is a disease state resulting from deposition of monosodium urate crystals in tissues. And Purines are not properly processed in our body, excreted through kidney and urine, and hyperuricemia build up uric acid in body and joint fluid. You see, can accumulate in joints, can accumulate anywhere, and can you see here can accumulate in joints and even in soft tissue, and also you see accumulation in different kinds of tissue with the formation of tophus. Tophy, the solid urate deposition in tissues, so maybe sometimes reach big size, this tophus, and here also tophus deposition. Tophus, this consists of uric acid crystals. And how you diagnose? By synovial fluid analysis, not serum urate. Of course, serum urate concentration will be high, but this is not representative of gout. To put diagnosis and take evidence, you should investigate the synovial fluid. You should provide synovial fluid analysis, and synovial fluid analysis. This is gold standard. Gold standard seen under polarized light microscopy, and it will be find out crystals intracellular during attack, and it's like needle or rod shape, and strong negative, and birefringence. Synovial fluid analysis also may provided in different kinds of arthritis and arthrosis, and here is differences between the normal, non-inflammatory and inflammatory or even septic arthritis and arthrosis, and amount of non-inflammatory content of non-inflammatory synovial fluid is different from content of inflammatory synovial fluid by color, by viscosity, by containing of white blood cells, and by containing of particles. And of course, how you can investigate the gout? Of course, by X-ray, and here is tophus presented and degenerative process of joint, and also in gout may occur deposition of crystals of uric acid in soft tissues, and here is gouty arthritis, and tophus can occur even in bone and formate the bone destruction. And at the end of our lecture, I'd like to remind to you differences between arthritis and arthrosis. As you mentioned before, arthritis is inflammatory syndrome. You see arthritis is inflammatory syndrome, and arthrosis is non-inflammatory syndrome. And pain in a joint, especially in the morning in arthritis, and early morning and night pain. Pain in arthrosis occur in the joint after repetitive using. At the end of day, for example, the more overloading of joint, and after overloading, formated pain. Swelling and stiff joints, red and puffy. This is character for arthritis, not for arthrosis. Also, morning stiffness in arthritis character more than 1 hour. In arthrosis, morning stiffness less than 30 minutes. And for arthritis, especially for which correlated with the autoimmune disorders, may present anemia. In arthritis, there is no anemia, there is no changing of lab analysis. And a sore wrist, finger, knee, shoulder, wrist or elbow, and here also a sore hands, finger, hip, knee, spine, mostly overload joints. Okay, thank you for your attention, my dears. If you have questions, you know my contact, you can contact with me.